Hello and welcome to Aesthetically Speaking. Today I want to talk about one of our most distinctive features, our hair. Hair is our identity. It speaks of our biology, our culture, and our personality. There is no other part of the body that can be as dramatically altered as hair. We can either straighten, curl it, cut it, color it, style it in many different ways. When it grows where we don't want it to grow, we pluck it, rip it out by the roots, or we can laser it to non-existence. But when it comes to losing it, that's when it can cause a lot of despair and depression. And there are many reasons why we suffer from hair loss. Could be that you've been ill, or your diet is not too good, or you're under stress, or have had a baby, or you're going into midlife and your hormones are fluctuating. But whatever the case, just remember that it is reversible and you can regain the growth, strength and condition of your hair. When it comes to genetic hair loss or inherited hair loss, then it can be a different story. And that's why I want to talk to Dr. Cathy Davies. She's also known as the hair guru, medical practitioner who graduated at Wits University and also got an MBA at Henley Business School. She has a special interest in aesthetics and hair restoration, and she's been doing hair transplants since 2006. Now, before you think that hair transplants are for rich old bald men, hold on, think again. There are burn victims and other people who can benefit from hair restoration and regenerative medicine. So come with me. Let's go and find out. Right, welcome to Aesthetically Speaking. And today we have with us Dr. Cathy Davies. And I'm going to jump right in. When we talk about aesthetics, people generally think about the outward appearance, the facial injections, the fillers, the pursuit of looking young again. But with your television series Outpatients, and that aired from 2018 to 2020, your aim was to focus on the more regenerative part of medicine. Tell us about maybe one of the people that you worked with that really touched you.
My very first hair regenerative patient involves a line attack and an eyebrow. And that's really what got me into it. I'm so grateful for the patients for allowing me to actually tell their stories. But I was paging through the U magazine and saw this beautiful young girl. Her name's Courtney, and she'd survived a lion attack. 6 months in ICU, they saved her life. She was looking amazing considering, but the lion had done that. When I saw in the magazine her one eyebrow was up here and one was down there. So I thought, right, I've just gained this new skill to do eyebrow transplants. We're going to laser this off. And so I contacted U magazine, who contacted her. And at the time she was, I think, 9 and came in for her eyebrow. And that also got me into then thinking, what can we do for her scars? And we have these amazing regenerative options, as you know, PRP, PRF. And through her, I just had so many other amazing stories and patients. So thanks, Courtney, to getting me into all of this.
Fantastic. Well, seeing you here with us today, let's talk about hair and health. Human beings all succumb to hair loss. You might take your hair for granted if you have healthy hair, but we've all been through the hair loss and various stages, and there are many, many reasons why we lose our hair. Maybe take us through all that, the reasons, and whether, most importantly, it's reversible.
I'm very glad you mentioned the reasons, because a lot of what we read and see on social media is just addressing one particular type of hair loss. And the most important thing, as you mentioned, when it comes to hair loss is getting an accurate diagnosis. It's like saying skin conditions. It could mean acne, psoriasis, same as hair. There are loads of different causes of hair loss. And some of them are very complicated and you need to go to a dermatologist who does a biopsy. But there are two main types of hair loss usually that we see. The one is genetic, which we'll talk about, and the other one is telogen effluvium. And the biggest clue between the two of them is shedding. If a patient comes to me and says, I'm shedding, and often they'll say, my hairbrush is full of hair, or even bring a packet of how much hair they've shed that week, that's pointing towards vitellogen effluvium. And it usually means that before it started, 2 to 3 months before, something occurred in the body, either a stress, a trauma, nutritional, some form of a stress to your body, that they decided they're going to conserve the energy to heal and not send the nutrients to the head. It could be general anesthetic, crash diet, Ozempic, for example. We saw a lot of it in COVID. Any viral disease, any fever. So those type of things, 2 or 3 months later you shed. It's very stressful, especially if you're shedding a lot, but it is hopeful to have that shedding because it's reversible. I always say that to patients because it reassures them. It takes a long time to get back on track. And the first thing is to correct the underlying deficiency, whatever it is, and to address the hair. But the telogen and effluvium is reversible. So that's the good thing about shedding.
And it could also be after having a baby, or it could be menopausal women, men and women who are in midlife and the hormones are all over the place.
Any imbalance. And I always look at a racehorse compared to a horse you'll find on the side of the road. A racehorse who has every nutrient and every comfort in life has this shiny, glossy coat, and then you have that fluffy, skinny thing on the side of the road. It's just what your body prioritizes.
If we are dealing or everything you've mentioned, obviously now we've said it is reversible, there is hope. But when we talk about the inherited hair loss, the androgenetic alopecia, did my homework, is there a cure?
No. It is a multi-billion-dollar industry. Everybody's trying to find a cure for androgenetic alopecia. It's also known as female or male patterned hair loss. And there is no cure at the moment. The tablets you can take to prevent further loss, a lot of them have side effects. The sprays, all sorts of things we do to keep as much as you've got, maybe grow a bit more. But there's no tablet or genetic treatment or anything that's commercially available that treats androgenetic alopecia.
All right, and what are the psychological effects then of this on the patient?
Sure, I'm not qualified to say. I would love a big study to be done, because my biggest learning curve since, as you said, 2006 to now working in the field of hair loss is the impact it has on patients. Very different on men and women, because of course it's far more acceptable for a male to lose his hair.
Yes.
The reason you don't see lots of bald women around is because it's so unacceptable, we'll cover up. But it doesn't mean it doesn't affect men. Certain men are happy, they shave, they carry on with life, but a lot of people are very impacted, so much so that they obsess about it, and it's what they think about every day.
Yes, because it's a crowning glory. Regenerative medicine. What are the treatments that might help that patient, as you say, to just stop or retard the condition from getting further and further along?
In regenerative medicine, we've used for a while now, in my practice since 2009, platelet treatment. That's your PRP or PRF. And the benefit there is they've got all sorts of different growth factors in them. Some that stimulate the hair follicle itself, but more importantly, they've got a growth factor called VEGF, which stimulates new blood supply. And we all know blood supply and hair go hand in hand. So I think that's why they work so well. And they definitely give hair a boost. The people you'll see on the pamphlet or the ads have a major boost, and some people just have a small boost. So it's quite unpredictable, but a very nice treatment for hair loss.
It varies from one patient to the other.
Yes.
With the PRP, which is the platelet-rich plasma, it's the patient's own blood that is extracted and spun and used. But my question is always the health of the patient. If the health of the patient isn't 100%, does it affect the growth factors in that plasma?
Absolutely. There have been times where the blood is thick and sludgy, oily, the patient's clearly dehydrated, or we actually choose not to use the blood.
Yes.
And there's certain contraindications. But in general, what we're basically doing is taking growth factors, which everybody has, even an elderly person, and concentrating them. So it's helpful. You won't react to it because it's your own blood, but it's not a youthful cell. So there's definite benefit from it. You're concentrating these growth factors, but yes, it's entirely dependent on the health of the patient, and there are things you can do to actually improve that.
Just take us through the actual procedure, the say PRF procedure or PRP procedure. Are there needles involved? Are there?
Yes.
Because a lot of people have a problem with this. So just take us through.
So I think the worst part for a lot of people, especially men, they don't like pain, is having the blood taken. So you take 2 or 4 quite big tubes of blood, and a lot of people just don't like that.
Yes. Well, but the trick is to just look away.
Look away, exactly. No one wants to see that. We take the blood, we centrifuge it at a specific speed so that the red blood cells fall away, and we're left with this beautiful gold plasma. It's got all the healing factors in.
Yes.
And the bottom part of the plasma has all the growth factors, and the top we can discard. And then we inject that substance. And that process is such tiny little needle. It's actually not, that part of the needling is not particularly sore. But I think it's more the blood, taking of the blood, that puts some people off.
All right. And then there was something I was reading about last week about hair filler.
Yes.
And it's for hair regrowth and scalp restoration. And it was using hyaluronic acid and peptides.
Yes, so that's another option. And basically, so when you're having this telogen effluvium or androgenetic alopecia, you want to wake the follicle up, give all the nutrients back, and all these other fantastic ingredients like peptides. Collagen's the most abundant protein in the body. We always want hyaluronic acid, whether it's face or scalp. So they very cleverly included all those, and amino acids, vitamins, minerals, all the good stuff. I think it's 64 things. You don't have to sit and have your blood taken, and you can inject it directly into the scalp.
All right. Well, look, if you don't want to do that, let's just talk about how you would keep your hair healthy through diet, through supplementation. And I'd like your thoughts on collagen supplementing, because that's quite a controversial thing. In your experience and having a look at patients who might have changed their diet and who might have stopped doing certain things with their hair, briefly tell us what the good stuff is.
I always tell my patients, first of all, we must think of a tree. We're dealing with the roots of the tree, and a hairdresser's dealing with the leaves and the branches. Okay. So anything damaging you're doing to this part of your hair, hairdresser, tree, keratin, whatever they do. We're dealing with the roots and the nutrients in the soil. The most important dietary thing is to have adequate protein. Protein. Exactly. And unfortunately, as we age, things cost a lot these days. We're on the run. It's hard to eat enough protein, but you have to. You asked me about collagen, and I am a strong believer in hydrolyzed collagen. People who are deficient in it obviously have a dramatic response to collagen, whereas, if you've got generally good collagen in your diet or you have in your bone broth, it's a nice to have. But some people really have a dramatic response, and those people really need to be on it probably for good.
Okay.
It is a great thing to be on. And then it's hard to punt one or a particular nutrient or other, because so many things affect hair. But the main ones are iron. The minute someone starts shedding and bringing in their bags of hair, I test ferritin, which is how your body stores iron. It's ferritin and hair in ladies are so linked. The other one is vitamin D, which is good for a whole lot of things, and zinc. But also the micronutrients, selenium. It's better to eat enough protein, have a well-balanced diet, and maybe a multi-nutrient than to read about something online. Oh, I'm going to start taking zinc for my hair.
50, I don't know how much of biotin or whatever.
Yes. Another very important thing about biotin is you must tell the doctor you're on it, because it actually disrupts your blood readings. A lot of people put themselves on whatever biotin, which is great, good for your hair. Yes. You may or you may not need it. And then suddenly you get these deranged blood levels. So you always need to tell the doctor whatever you're on, even if it's not.
And I would think that people on a vegan diet, there's a lot of iron deficiency if they're not supplementing enough. Yes. But also, what about braids?
Yes, so that's also a root issue, and that's an issue of blood supply. You find with ballerinas who wear these, or professionals, very tight buns and ethnic hairstyles, braiding, putting pressure on the front. And I always tell my patients, if you're braiding your kids to school and their eyes are going like this, or if it's so tight that you have a headache, it's too tight. Yeah. And there are a whole lot of safer braiding styles where you use big box braids, massage in between, give your hair a break. There are a whole lot of
in
styling
between,
tips.
maybe take a little break. I did want to touch on the hair transplant surgery because it has been around for a while, but it's advanced exponentially. So you do a lot of hair transplant surgery, and tell us about the follicular unit extraction technique and why it's so successful.
So it's just a fancy word for how we take the hair out. Previously, the only real option was to cut a strip of skin and hair, chop it up into pieces and put it in, which was great for the time. But it looked, first of all, you were left with a scar and it looked a bit pluggy, like almost like a doll.
Yes, yes.
And some very clever people in Australia developed this technique to take out hair by hair. So it's almost like a tiny punch, less than 1 millimeter in diameter, that we put over each hair and take it. And that's called a follicular unit, which it's like the hair it grows in a unit. So it's either one hair or it's twins or triplets. So whatever how it naturally grows, that unit, that's why it's called follicular unit extraction. Very fancy word. We take them out one by one. Nurses count them, and then it's very superficial. So those scabs heal up really quickly, and then we put them in one by one. It's time consuming, but there's far less scarring. It's a much easier process and very natural.
And I'm sure just psychologically, it just brings that patient a lot of self-confidence.
Absolutely.
Which is important. And who are the ideal candidates, by the way?
We're really relying on your donor hair. With the transplant, we're taking hair, I call it the Joshua Door hair, that thick ring of untold hair instead of man. Unfortunately, as women, we don't have that. Yes. So when women thin, it's generally all over. So they're not great candidates. With women, we do all the blood tests, full medical consult. Yes. Whereas men, if they've got this thick, rich donor hair, we can take it and put it wherever they need it, and it grows. And because it comes from here where there's no receptor to balding, once it grows, it's there for good. Men with this thick hair here, if you've got just a little bit of thin hair at the back, they're not ideal candidates. Okay. But it really depends on the donor hair.
Right. And lastly, what about needle-free scalp?
Oh, that's amazing. I actually saw a needle-free injection online, and I hunted down the people, this needle-free technology, and it's developed by MIT, very clever people. And it's really clever because it uses, so it's needle-free, and they came and did a vitamin B injection for me. And they can vaccinate a whole class of children in like 10 minutes. And it's neat. So it's amazing technology, but everybody hates needles. So I thought for hair it would be great. And you can so although you have to take the blood with the needle, you can inject a whole head with plasma, full 5 mils up to 10 mils. I think it took about 4 minutes. It's amazing technology.
Amazing. Just amazing. All right. And then just your tips on keeping our scalp healthy and your hair as healthy as need be, because we are living longer, and so we need these tips.
So I think we've touched a bit on nutrition, which is obviously very important. Yes. And it sounds obvious and almost impossible to do, but stress management is key.
We haven't spoken about
stress and hair have this link. There's actually a receptor on the hair follicle to cortisol, and it manifests in some people. Everybody has a different area stress manifests, but it's very linked. And you'll find in a lot of the more advanced hair supplements, they're putting in adaptogens because they realize how important adrenal glands and hair are. Yeah. So manage your stress, adrenal glands, for everything. Gut health is important. We're learning that about everything. Look after your gut. And then actually with the hair itself, treat the scalp as if it's skin. It mustn't get clogged up. If you use lots of gels, products, it needs proper double cleansing, exfoliating, and it doesn't like heat. So heat products are. And then another thing, which isn't really hair related, but the minute a hair thins, the first thing I see on the scalp is sun damage. I always do a full check of any lesions because I think it's because it's 90 degrees to the sun. So the minute there's thinning, the first thing that happens is the pigmentation, the little moles or whatever that comes, seborrhea, keratosis. Yeah. If you're not going to do anything about your hair, you need to start protecting your scalp from the sun.
Wear your hat.
Yes.
All right, well, thank you so, so much for joining us on Aesthetically Speaking and for giving your time so generously, your knowledge, and just imparting your enthusiasm and your joy to us.
Oh, thank you.
So, so much.
Thank you for having me and for spreading the
Hopefully we'll have you again on a follow-up.
Can't wait.
I hope you found this video informative and helpful. If you did, please like and share it, and follow us on Aesthetic Appointment for the latest in aesthetics. Also to find out when the next episode of Aesthetically Speaking will take place. Remember to be kind and to be beautiful inside and out.